You are listening to ToRAISE Questions Doula podcast. I'm sitting across the table from Therese Hakoon.
I'm sitting across the table from Melanie Headland.
Therese is the executive director of the international doula training and certifying organization called ToLabor.
And Melanie is the podcast co-host with me and also a doula and a certified...
I'm a mom.
You're a mom first. Yeah, you picked up my... Yeah, good. She's a mom of 4, a wife. She is a doula, certified ToLabor doula. She is a certified childbirth educator. She is a certified lactation educator. Counselor, you call yourself. And she also has another job working with...
Centering pregnancy
in the city of Richmond through the college, the university hospital. So she's a busy woman. We see her a lot on Instagram and Facebook, also living a life of social life. And we're like, how does she do that? And then I go, I don't care. I think you're tired, and I'm past those days
That's
of
true.
wanting to be
I'm
that.
tired.
Yeah. So
it's so nice to be sitting here we've got a little fire going.
Yeah. Which maybe I should take a picture and post on the Facebook page of our little fire.
Romantic
yeah,
in
it's
here.
really nice. So today we've gotten a really interesting case study. Yeah.
So we've gotten an email from one of our listeners. Thank you for listening, Marcia. And Marcia's calling from Maine here in a little bit. I'm really intrigued to talk with her about this.
Yeah, I think I love, and I think everybody who listens to podcasts really like the stories from other doulas. And I think each one teaches something and helps us in that journey. And I think this will be that as well. So keep listening. We'll be right back with Marcia.
So here we are with our case study, Marcia. Marcia, are you there?
Yes, I'm here.
Okay.
Hi.
Marcia, you're from Maine?
Yes.
Hi, this is Therese.
Hi.
And Melanie is talking to you.
Yes, hi. And we've already said hello, but hello again, Marcia. Thank you so much for emailing us and really sharing this story with us. We really, really appreciate it.
Yeah, we think it can be something that a lot of doulas can relate to, and we hope not to a big extent, but I think it's really an important story to tell. So, but before we get started, tell us a little bit about yourself, your background. Are you a mom? I know you're a doula, but how long you've been a doula? Are you attending births currently? So forth.
Okay. I've been a doula for about 4 years. I trained with DONA, and I'm also a Lamaze certified childbirth educator, and I'm also a mom.
Mm-hmm.
I have a 4-year-old and 4-year-old little girl and an 18-month-old little boy, and I'm expecting my 3rd in May.
Nice.
Oh, congratulations.
Yeah, hope you're
Thanks.
feeling good.
Thanks. So I am attending births, but very kind of once every other month.
Mm-hmm.
And I'm teaching about 4 nights a week, teaching childbirth classes.
Great. And will you take some time off? When will you stop attending births? Because I ask that only because it's always one of those questions that pregnant doulas or people who are considering being pregnant who are doulas wonder.
Right. Well, with my son, I attended my last birth at around 34 weeks, and I think that was really too late because it was one of those marathon births, and it was too much. So I think probably around 30 weeks.
I commend you on that. I think it's a good time to give yourself time also just to focus in on you and not somebody else who's going through your experience or something similar to you. And then you'll take some time off after you have the baby.
Absolutely. Yeah.
Yeah. Good. So why don't you give us all an overview of your experience. And if we interrupt you, please excuse us. It's just because that's what we do. I do really well.
That's true.
That's totally fine.
Okay.
Okay, well, this is this was kind of a turning point in my career because it almost made me stop attending births altogether. It was about 2 years ago, in December. I had a couple that was referred to me by an OB that is also a friend of mine. And so they kind of hired me last minute. But we were still able to fit into prenatal visits and felt like we had a really good relationship. Their Labor Day came. I met them at the hospital, and right away she seemed to be kind of in transition, like contractions. Like it seemed very intense. And when she had been checked right before I got there, she was 2 centimeters. So I knew that this was probably a positioning issue that was giving her these really intense contractions. Just really intense, long, 2 to 3 minutes apart. Typically, they're not that close together so early in labor. So we really tried to do lots of movement and just gentle repositioning techniques. We used the rebozo a lot. But otherwise, she was doing really well. And despite the intensity, she was coping really well. Her husband was an awesome support, and we just seemed to be really working well together. So time went on. The contractions really didn't let up at all, despite our efforts. About six or 8 hours later, details are kind of fuzzy now, but quite a while later, her doctor came to check her, and she was 4 centimeters. So that was pretty good progress.
Yeah.
Yep.
And she told us to keep doing what we were doing. Mom was still coping really well. We started walking around the halls, kept on using the rebozo a lot because she really liked that. And the doctor, she's really low intervention. She's an awesome doctor. She didn't come back to check her for quite a while. It had to be at least, it was the morning when she checked her, and it was after her clinic was closed that evening, so it had to be at least 8 hours. And she was still 4 centimeters when she came back. So that was disappointing, and there was really no effacement, no station change as well.
Could they tell the position of the baby, or was there indication to you, or was there any discussion about the position of the baby?
There was, and from what I could tell and from what the doctor could tell, there was no real positioning issue. Everything seemed okay in that aspect. That was really confusing.
And were her contractions still like?
They were still like I felt like we'd been in transition all day long.
Interesting.
So it was difficult, but she still was determined to continue on with what we were doing. So we did.
And was her provider the doctor that that referred her in the first place?
Yes.
Okay.
Yes. And so the doctor, she was not on call that night, but she ended up staying just because she just really took an interest in her patients.
How unusual.
I know. That's wonderful.
That's really nice.
Yeah, no, she really is. She was really that's kind of what, well, I'll go back to that at the end, but looking back, seeing that there's a lot of things that just really couldn't have been helped. But so we really continued on. After midnight, the doctor came back to see if there was any progress, and she was still 4 centimeters with no other progress to speak of. So they started Pitocin.
But
at that point.
Do you think that she was just in prodromal labor that whole time, even though it was hard? I mean, I just want, was there, and this is just a question. Was there ever a discussion right from the beginning or early on about going home?
Yes. So the doctor did offer that.
Okay.
At one point. And she asked her if she wanted to go home, and she said no.
Okay. That's good to know.
That's really
and
the fact that she had progressed 2 centimeters at some point kind of made us think that maybe she was actually in labor.
Right. But I'm glad that's an important I'm glad you're sharing that part, because I think that feeds into the rest of the story also of she was given that option,
right, that's
and
important.
made a decision not to go home.
Yes.
Yes. Okay.
So she started Pitocin, and she labored with the Pitocin for, a long time. And about 4 or 5 in the morning, with her permission, I posted on a forum of doulas that I work with to see if anybody had any advice. So people offered some advice. I tried a couple different techniques. I was still sort of a new doula. That was about my 10th birth.
Mm-hmm.
So there's a lot that I didn't know yet. Still a lot I don't know. But so I took some advice from more experienced doulas. And when the doctor came back in again to check her in the middle of the night, she was still 4 centimeters even after Pitocin.
And how was she communicating with you? I mean, you said when she came in, things were good and her husband was supportive, but what was your feeling coming from her, that if you can remember, like you guys still have good rapport going on? She's still open to suggestions with you and so forth?
She was.
Okay.
Yeah, I think, so looking back, I think that was kind of part of the problem, is that she kind of depended on me for everything. And I kind of would have nipped that in the bud if I had known more.
How do you now in hindsight, Marcia, how would you what do you mean by that? What would you have changed?
Even in the prenatal appointments, it seemed like they assumed everything was going to go perfectly because they had hired a doula. And I think it's really important that people understand that we're not miracle workers, that we do what we can, but there's some things that, we can't control.
Exactly. Yep. We've had this discussion. Okay.
Are you also there?
Yep.
Yeah, sorry.
Okay.
Go ahead.
So she had been on Pitocin for a number of hours, still no progress. So she decided to get an epidural, and she felt good about that. She'd worked really hard all day. It didn't seem at all like she was going to regret that decision. And we spent a long time talking about it with the doctor and her husband. And at that point, I was also pregnant with my son at that point. I was starting to feel quite ill after having been with them for over 20 hours.
Mm-hmm.
So I called another doula to come assist me. One of the most experienced doulas in our area. And so she, in the middle of the night, came out to help me.
But you stayed. You stayed.
I did.
Yeah.
I went out to the lobby to rest for a few minutes.
Right.
But, and that kind of comes in later in the story.
Okay.
So she came, we tried some side lying release, which I'd already done, but we tried it again. And just other positioning things. I think they both saw how tired I was, and both the mom and the other doula asked if I wanted to just try and get in a quick nap.
Mm-hmm.
So I went out into the lobby and just rested for a little while. And while I was gone, the other doula, Jenny, was texting me that she was just asking her about any emotional issues she might have that might be stalling labor. And didn't sound like anything had come up.
Mm-hmm.
So at some point while I was out in the lobby, things kind of went south, and there was some pretty intense fetal distress. So they decided to do a C-section.
Were you in the room when the decision was made to have the C-section?
I was not, but Jenny was in the room, and I'm fully confident that she counseled them and, helped them make that decision.
Sure. And
not help them make the decision, but,
Right. Yes, gave them support.
Right.
Did you feel when you had been with Jenny and the clients that they were good with Jenny being there and you calling in that support and stepping out for that time being?
At the time, I mean, it seemed like they were. I talked about it with them before I even called her, and they thought that was a good idea. So I explained to them, I've been to 10 births, she's been to hundreds. She might have something valuable to do to help us.
And another question, is that in your contract that you...
No.
Okay.
Well, I do have in my contract that I call backup, and I have since added that, especially during
That was my
pregnancy,
next question.
Yeah.
Yes.
I have since amended my contract that, especially during pregnancy, I will call in a backup for health reasons after, I think it's 18 hours.
Good.
Yeah, and we're just going to pause there for a second to add in that is so common that we amend our decisions, our contracts, our way of practice, scope of practice based on experience. And that's often what it takes. And it's legitimate to draw your boundary lines and understand what will serve not only your clients well, but you well too.
Right.
Yeah. So, okay, go ahead. So you weren't in the room when the decision was made to have the C-section, but
Correct.
Then what happened? Jenny must have alerted you to that, yes?
She did. Yeah, and I got back right as they were kind of wheeling her out, and she looked okay. She thanked me for being there, and she seemed okay with everything, although I'm sure, inside she wasn't. The C-section went fine, as well as a C-section can go.
Right.
And
were you able to go in with her?
No, I
Okay.
wasn't.
Okay.
Yeah.
And then were you there when she came out?
I was briefly, but I was at that point kind of having to run out to the bathroom to throw up because I was still kind of in early pregnancy. So Jenny told me to go ahead and go home, and she would stay with them for a couple hours after the birth. But before I left, I made sure that everything was fine, and they were they thanked me for being there, and the following day, a couple hours later, well, I guess that day, just later in the day, they were sending me pictures of the baby and texting me, and everything seemed fine. So
Right.
a week goes by, and I call them to set up our postpartum visit, and they don't return my phone call. I call them again a few days later, and they don't return my phone call. The next week, I emailed them, trying, maybe they're having a hard postpartum. I don't want to be too intrusive. I emailed them and just said, hey, at some point when you're feeling up to it, I'd love to have a postpartum visit to talk about stuff and see how you're doing, if you're having any trouble breastfeeding, just the typical thing.
Right.
And didn't hear back from them. So at this point, I'm kind of getting the point that something is not right.
Yeah.
Because they've never not responded to stuff. And talked about it with Jenny. She did not, nothing came to her mind that, they didn't say anything to her. Everything seemed fine when she left. She didn't feel it was her place to contact them, but she said she would if I wanted her to. But I said that was all right. I would handle it. So I wrote them one more email and still didn't hear back. And then so the following, I think this had to have been at least a month later, I wrote them and I said, I understand if you don't want to have a postpartum visit, but I do need my materials back that I lent you. So I lent them some books and some LED candles and just other stuff.
Okay.
And so I did hear back from her from that email. It's a very short 3 sentences. We'll leave your stuff in the mailbox. Please don't come to the door. Thank you.
Wow. Oh, Marcia, what was the sense in you right at that moment? Honestly, what did you feel?
Oh, just sick. Just absolutely sick. Because I have never, even to this day, I've never worked harder on a birth. I ended up paying Jenny most of my fee to be there. So, which I don't regret at all. I'm glad that I was able to pay her. But so basically, did that birth for free and worked extremely hard. Was with them for almost 30 hours. And
Not and prenatal time as well.
Yes. And so for a long time, I felt really guilty about it, that maybe I should have just stuck it out. I shouldn't have called Jenny to help me, because that was the only thing I could think of that could maybe possibly make them upset, even though we had really talked about it beforehand.
Did you, just let me ask you before you finish that, did you, after you received that stunningly, shocking email back from her, did you respond back or ask any questions, or were you just like, okay, I get the message, I'll just do what they tell me to do?
I did not write back after that.
Okay.
Because I didn't really know what to say.
Mm-hmm.
And it took me kind of months to process that they were blaming me for things.
Mm.
And I did blame myself for a long time, but after lots of conversations with Jenny, and with all of her experience, she explained to me that sometimes when things don't go well, people want to blame somebody.
Mm-hmm.
And even if it's not their fault. And she thinks that that's probably what they did with me, that they kind of projected their disappointment and, loss of what they had hoped their birth would be like.
Mm-hmm.
Right.
Like, well, we hired a doula. It shouldn't be like this.
Right. And I think, the hard part about your story, Marcia, is that it is, the work we do is so intimate and we get so invested in it, in wanting the best for somebody, and never with any thought of ever causing harm, and knowing also our limitations. Like you said, you're a doula, you can't make it happen one way or the other. Her body, her labor was what was happening. The baby, everything, the decelerations, everything was out of your control. You were doing the best that you could.
And you're also human.
You're human. You're not feeling great during the experience, and you're doing the best that you can to stick with the experience, and you're wise enough to know, okay, I need to call somebody else in to give support, and you check in with them, you seem to get the understanding from them that it's okay for you to go take a quick nap. I completely agree. I've had this conversation over the last 20 years with doulas when this has occurred. You have to do a really strong introspection of what you did and didn't do, and was there something I'm really, to quote unquote fault, at fault here. But if your worst offense was that you didn't feel well and you had to lay down, but you didn't abandon them. So it's really not the worst offense that you had to take a rest. And the only other thing I could see, that you didn't stay for the whole postpartum recovery stage, but you didn't again abandon them, that you left them with the person that they also had been with for the last few hours. Right. If you can't see anything else, then it really does come down to, it is not your fault. And it is really hard to convince yourself of that, because we don't want someone to be disappointed with us. We don't want someone to be angry with us under life experiences, let alone your professional experience, and especially surrounding birth. It just feels like those things don't mesh in any way. It's supposed to be everybody is happy. Even no matter what the outcome is, everybody feels like, okay, I did do this. And it sounds, from your story, there were so many options and choices given. And that's why I thought it was important, like the going home part. And the idea of calling in some fresh energy, other doulas have shared this, and that they've had to do as well, because they're just at that breaking point of, I'm exhausted. I can't. I know, Melanie, you were called in for Sarah one time, who used to do the podcast.
That's right.
Because she was just...
She was going between two births at once.
Right.
Yeah.
And she was just having a really hard time functioning. And she just needed, and how she described Melanie, she said, and Melanie came in all fresh and all like ready to
As I'm
get,
sure Jenny did for you.
Energy to it.
Yeah.
Yeah. And so, the heart, I think a year and a half ago, you probably got the answer that we're discussing right now, which is it really isn't your fault. It really wasn't you. It really was that something was not okay with them in the end with the experience. And instead of really looking to themselves for it, they put it on you. But the hard part is a year and a half after that maybe conclusion, you still feel
I do.
Yeah.
It still feels a little raw.
Yeah. That rawness. Yeah, I was going to say agony, but rawness of it. And that's the hard thing to shake is we are not able to control nature in that way and other people's natures in that way. And I think it's really sad. I wonder also what popped in my head was if they themselves just felt embarrassed I wonder if she just felt like she failed and she was not able to, some people have emotional blocks where it's not even that they blamed you. It was more like
they just couldn't even go there.
Yeah, they couldn't go
process.
There. Yeah, and to do it would be like if you came, then they would have to talk about what they did, what they were feeling, what they were doing, and you interpreted it as they don't like you, you did something wrong, and maybe it wasn't even that. Maybe it was that she just couldn't wrap her head around the end result. And the hard part also is often people, this, we all know this, that somebody in her postpartum time, an outsider, a family member, a friend, might have said something that was so inappropriate about the doula.
That's my thought, because I feel like it's interesting that immediately after they were sending you pictures and they seemed like they were okay with it, and then it took that week for them to kind of change their minds or just change the way of communicating with you.
Yeah, I hadn't really thought about it that way.
Yeah, I can hear a family member or a friend saying, well, what was your doula doing that time? She was sleeping? Well, and not putting all the pieces together. And, the vulnerable mind, it as a mom yourself, the vulnerable mind, the open vessel you are after you give birth, you're so susceptible to everything that how it then suddenly becomes a different story in her mind could have been what made her change. Because I agree with Melanie, it doesn't make sense to be all okay and then not be okay to a point where she can't see you, she can't face you in that way.
Were you able to process this with your doctor friend?
I was, thankfully, and she was kind of equally as disturbed when I told her the kind of end result.
Mm-hmm.
And she assured me that it was not my fault. But she thought maybe there was some cervical scar tissue that was preventing things, and
which I wonder, did you know anything about her history, whether she had like, a biopsy, a LEEP procedure done?
Well, since that birth, that is something I ask in my prenatal.
Yeah.
I didn't know that was an important thing to ask.
Yeah.
So that's on my intake form now.
Yeah.
It sounds like this birth was really difficult and challenging for you and traumatic, but you've also learned a lot of lessons from this birth, and I have to say I'm so glad you didn't quit.
Yeah. Because what a shame if that is what would have sent you out when there were so many other people, 9 births before and many births after that really benefited, and I'm sure loved having you present at their experience. And I think you also made a valid point. It's something we just talked about in an episode about doulas not being we have to help our clients understand we don't provide an unmedicated birth or a painless birth. We provide good support, and that's the best that we can do. We're not a guarantee.
Yes, that's something I really try and stress in interviews now, and I think that's probably lost me some clients because I think people are looking for that. It's just not a reality.
I think it's good. I mean, that's another thing that you have grown in your experiences. That is something I said right from the beginning. I've shared this, that I remember specifically one person interviewing me on the telephone, and this was before there were, lots of doulas in the community that I live in, and so I was the doula, and they wanted me there to do everything for them. They just wanted to labor, and they wanted me to, communicate and do all the things that I was like, sorry, I don't do that. That I explained very clearly what my role was and how I would help them and how I would help them communicate, but I was not there to do their birth. They had to do their birth, and they had to still have their own voice. And they kept arguing. It was such an interesting conversation of wanting me to change my mind. And I said, I'm sorry, that's not how it works. And I said, if you would like, I will try and help you find someone else's name that you can talk to. But otherwise, I would be happy to be with you if we can work this out in this way. And I didn't end up doing their birth, and I was relieved because that was not a role I wanted to be in, because I would have been to blame.
And you were being set up to fail.
Yeah. And if they had succeeded, it would have been about me, not about them. And if I had failed, if they failed, quote unquote, and I say failed in their eyes, then it would have been about me, not about them.
Right.
Yeah. So I think, what I really appreciate you sharing this story, Marcia, because I think it's a hard one for doulas to go through, but I think also what you provide is what you learned from this experience. And, the only thing I would add, and it's not, please don't take this as a criticism, because I can't say, I know it must have been like a nail gun to your heart right at that moment when you got that message from them that they just wanted you to pick up things in the mailbox. I might have followed through with a handwritten, like a letter to them that I am so sorry that, whatever you feel, your words. And if any time you would like to discuss the experience that you had with me, please let me know. Just that last follow-up of, and I think that's the closure of, it leaves the door open. And again, I understand why you didn't do it, especially after so many attempts to try. But that would be my only other suggestion to those who are listening, if you find yourself in that place. But I didn't, or I'm sorry you felt that way. I'm sorry that we're not able to connect. I'm sorry that perhaps something transpired that has made you not want us to finish this relationship. If there's a time and a place that you would like to discuss it, please let me know. I will be available to you. And then end it there. And then, no excuses, no explanations, just leave the door open. And sometimes people are willing to walk through that door, maybe not that day, but maybe months later, or their next pregnancy, when they go, what do I do now? So you never heard from them again?
I didn't. And there's been so many occasions where I've been tempted to try to contact them, but then I felt that it was just...
Yeah.
Just something told me it wasn't a good thing to do.
No. At this point, after a certain point, it's a done deal. It's just that I'm just curious. Do you know are you still friends with the doctor?
I am, but she has since moved to another state.
Okay. So you don't, I was going to say, I wonder if she got this person, more than likely had another baby. I just wonder what her experience was. Not that the doctor could necessarily tell you that, just more that if she had gotten pregnant again. Well, I just think it was a hard story and a hard lesson. And I really appreciate you sharing it with us. I really do. So thank you.
Thank you so much.
Thanks for having me.
Yeah.
I hope that any doulas who have a difficult birth like that, maybe they want to take a break, but just keep at it. I just attended my 37th birth on Monday.
Great.
Good.
I'm so glad that I didn't quit. But
Yeah.
it was,
And I think the other thing that you can share with the doulas is how important it was also to have somebody to, voice this, work through this experience. And had Jenny not gone to that birth, I would hope, and I think you would have, since you said you were part of a group of doula support, you would have found support for yourself to be able to work through the experience, because that's another really important thing, is letting it go so you can move forward into the next experience. You can't carry it into the next birth if you make the decision to continue to move forward. So I think that was another really wise message. Yeah. So thanks so much, Marcia. Hope you're staying warm in Maine.
Thanks.
We'll talk to you later. Okay.
All right.
Okay.
Thanks.
Bye.
So we've convinced Marcia to stick around for a second and give us a tip, and to finish this podcast out on a positive note.
Yes, which it was positive. It was just a hard positive. Yeah.
So Marcia, what do you think?
Something that worked really well for me in a recent birth was I had a mom in transition in the tub, and she'd been doing really well, and then really intense contractions started. And as it built up, she started kind of vocalizing, no, 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 and kind of backing away from the contractions. So I thought it was maybe a one-time thing, but the next one she did the same thing, and the next one she did the same thing. So on the next break, I suggested, instead of saying no next time, why don't we try and say, yes, I can do this, and I'll say it with you. And so the next contraction came on, and together we said, yes, I can do this. Yes, I can do this. Yes, I can do this.
Oh, I love it.
And just immediately she stopped backing away, and all the energy in the room changed. Her husband seemed more relaxed. He seemed really concerned when she started the no business. So I think that really helped her finish out that transition phase in a positive way.
Great.
That's beautiful.
Yeah, that's
what
such
a great idea.
Yeah, it's that, or yes, I think that's just really good. I'm sure it helped her relax too, to have more of a positive way of seeing things. Though I just have to say, one time I tried something similar, and because the woman was cursing one very intense word over and over again. And when we said, okay, here, why don't you try, like open, 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 she used that curse word and said, blank, no, blank, no. So that was her word. It wasn't going away. But I think most times it absolutely is such a positive way to change, because telling no isn't a good way to be trying to move forward. So I love it. Thank you so much, Marcia. Thanks again for being with us today. We really appreciate it.
And have a beautiful birth yourself, Marcia.
Yeah. Take care of yourself.
Thank you. I will.
Okay, bye now.
All right, take care.
Bye.
Thanks for listening, everybody.